Thank you so much for taking the time to watch this video about how environmental asthma triggers can affect children at home, at school, or in a daycare facility. If we look at our program that we have instituted over the last 6 years in Missouri, we can see that it has been very effective in identifying and then minimizing exposures by looking at the number of children who go to the emergency room or go to their doctor for a sick visit due to asthma. And we see a tremendous difference between children who participate in our program and children who do not. For those children who participate, they have an 80% less visit rate to the emergency room due to their asthma than those children who don't, and they live in the same area. We also look at sick visits to their physician, and we see a 5-to-1 ratio for children who do not participate versus the children who do. They're 5 times more likely to have to go to the doctor than those children who participate in our program. If they're not at the doctor, where are they? They're at home, they're at school, and they're enjoying life a lot more. This program is so successful not just because of the information that we're able to give out, but it's because we have a great set of champions who help us, from healthcare to the parents of the children who are ill. They both realize the importance of getting the right information and helping them to get better.
Okay, as respiratory therapists, we are some of the primary communicators to our patients about respiratory disease.
In the hospital, when we're dealing with patients and educating them, we're educating them about their disease and their medications that they're going to go home on.
This educational opportunity gives us the opportunity to discuss with our patients the importance of indoor air quality and the disease triggers, asthma triggers, that these patients face.
The home assessment, it does reiterate some of the medications and what they're on and how those medicines work.
And it allows us to offer them the opportunity to have indoor air quality professionals do an assessment so that we can help them manage their disease.
Then you're also going into what's going on in their home environment. How can we improve the air quality in their home so that they can function better?
The use of an electronic environmental assessment program gives us immediate access to this data so that we can use that to help determine why our patients are returning to the emergency room for treatment.
The EPR 3 guidelines adds to the traditional medical model by providing an environmental management which helps our patients manage their asthma better.
Asthma is a recurring illness that can be triggered by elements found in our breathing air. Child care facilities, as well as your home, contain common pollutants that can trigger an onset of asthma. So what is asthma? Asthma is a disease that affects the airway, specifically causing the bronchial tubes to become inflamed. This inflammation can be triggered by specific allergens or respiratory irritants found in a home or child care facility. These triggers lead to symptoms of tightness in the chest, wheezing, coughing, and difficulty in breathing. Indoor environments can increase the chance for asthma symptom onset because of confined exposure to air pollutants. Tobacco smoke is a strong irritant to the respiratory system. Also, outdoor air pollutants such as ozone, pollen, and mold can aggravate an asthmatic child's airway. Affected children should remain inside when outdoor air conditions create breathing challenges. Indoor humidity levels are capable of helping mold and dust mites grow and increase the chance of asthma symptom onset. You need to control indoor humidity levels so that we can protect our children better. The control of asthma requires the understanding of many factors that can be used to manage the disease. And that's what we call a comprehensive approach to asthma management. So what's that? Comprehensive approach integrates education, medication, and the environment into a program that deals specifically with the disease of asthma. All these elements working together can manage a child's asthma much better. Environmental conditions found at home and at a child care facility are key in controlling the onset of asthma. For example, mold growing behind wallpaper may be releasing spores or toxins that could adversely affect a child. Particles found in the air can cause asthma symptoms to occur rapidly. Have you ever seen the smoke in the air when agriculture fields are being burned? The large white building that you see in the background is adjacent to a school building. Could this be a bad day for children during recess? Particulates are extremely small particles of solids and liquids. They are very capable of causing harm, but they cannot be seen by the naked eye. How many times have you seen a child run across the room and jump into the couch? Have you ever seen the particles that explode from those seat cushions and find their way into the atmosphere? These 7 items are the major indoor air triggers found inside any building: dust mites, pet dander, environmental tobacco smoke or secondhand smoke, mold, fungi, cockroaches, rodents, or other pests, combustion residues, and bacterial toxins. Dust mite body parts and droppings can be found in many places indoors, such as the carpet, upholstered furniture, mattresses, and pillows. They can even be found in stuffed toys. Here's an example of a young girl holding a large stuffed animal. You can see that she doesn't feel well, but look what happens when you take the large one away that wasn't cleaned or washed or properly dried and give her a small one that can be taken care of properly. Look at the difference in her face. Doesn't she look happy? Cockroaches are capable of triggering asthma symptoms when an affected child comes into contact with their body parts or their droppings. In addition, rodent skin flakes and hairs, saliva, and urine act as indoor air triggers. We've all seen those familiar pictures of cockroaches, but how about that sneaky little mouse trying to come out of the oven to get that last piece of pie on the dish? All of these asthma triggers can occur. Here's a familiar picture. Pets are capable of causing asthma even in buildings where we don't have them. The triggers attach themselves to clothing and other objects and are then carried to other places such as schools, childcare facilities, or even our home. Water damage allows molds to grow pretty much anywhere within a home. This mold can cause indoor air pollution that can affect asthmatic children. How about environmental tobacco smoke? Think about this. Children of all ages who live in homes of smokers are 63% more likely to have asthma. 63% more likely. And children of teenage mothers who smoke have a 3-fold to 5-fold increased risk of developing childhood asthma. There are other sources of irritants inside buildings, which include aerosol, air fresheners, cleaning agents and detergents, hair products, potpourri, even chalk dust. All of these are capable of affecting children with asthma. You can see that she loves this. Look at her face as she sprays it, but can affect anyone. Even the young boy running up to her doesn't like it, and that can trigger his asthma if he's sensitive. So how can we make the indoor conditions better? When we think of dust mites, we can think of allergen-safe covers that can be used to reduce exposure to dust mites. Regular cleaning can reduce dust mites in rugs, furniture, and even stuffed animals. A reduction in humidity will slow the reproduction rate of dust mites indoors, which means we have less of them inside to affect our children. That's important. The use of proper cleaning techniques, proper waste disposal techniques, and preventing indoor entry and using non-pesticide spray-related pest control will reduce the chance of asthma onset due to cockroaches or rodents in our home. Keeping your pet clean and keeping the pet outside the sleeping area can reduce your child's exposure to allergens capable of causing asthma related to the family pet. We never want to get rid of Fluffy. Let's keep Fluffy clean. Keep them out of the bedroom. If you have areas that are affected by mold, you should make sure you take care of it appropriately. The first thing you have to do is repair all of those water leaks and eliminate water sources. If you do that, you have taken away one of the primary materials needed for growth. You keep it clean. You keep your ceiling tiles and carpets that have become infested by mold away from children. And we have a better way to keep a healthy living environment for our children. Whenever we examine the effect of pollens and outdoor molds, the first idea we should have is to say, let's watch the news, let's read the newspaper. If we keep a good look on the air quality index for our area, we can determine the possible impacts on our asthmatic child. Environmental tobacco smoke is a huge player in children's asthma, so stop smoking in your house or your car. Indoor air quality interventions are a key in controlling or trying to manage your child's asthma. The reduction of indoor air pollutants provides a healthier environment for everyone. The use of a global asthma intervention program allows us to protect the respiratory health of all children in child care facilities, at schools, and even in our homes.
The asthma triggers in my home that I have learned of are smoke, dust mites, pet dander, and mold. And I've also learned how to control those and to make my home safer for my son.
The things that we've learned about environmental triggers and how to deal with them is how to deal with dust mites where they are, how to get rid of them, mold, how to handle that, how to keep that at bay. Mainly for me, I'm allergic to dust mites, and I know now how to try to control them as best as possible.
Thank you for taking the time to review this video and to learn all that you can about how environmental asthma triggers affect children. If you have any questions, please contact the program. And remember, this is about improving the quality of life for each and every child. Thank you.